Good day, everyone. Today, we are going to be looking at patient's autonomy, application and implication in healthcare practices. My name is Ofojebe Dixon. Content of presentation. We shall discuss patient's autonomy as one of the 4 ethical principles, the meaning of patient's autonomy, duties and responsibilities of patient autonomy, the scope and approaches to patient's autonomy, limits of patient's autonomy, challenges to patient autonomy. Then we'll have a summary of this presentation and some references for further consultation. Autonomy is one of the 4 ethical principles, and the 3 others are beneficence, non-maleficence, and justice. Ethics is the structure or critical examination of standards of right and wrong, and principles are fundamental preposition that serves as the foundation for system of belief or behavior or for a chain of reasoning. So ethical principles are rules or foundations of ethics. Ethical principles, it is important to note, do not provide direct guide that ensures that one makes ethically correct decision, nor do they offer guidelines about ranking when ethical principles appears to conflict with one another. However, they offer consideration that should be weighed when making decision. The meaning of patient's autonomy. Autonomy refers to the capability and ethical legal right of an individual or community to determine actions. Patient autonomy is essentially the ethical and legal provided right of a patient to self-determination. Patient's autonomy is not an absolute right, as we shall demonstrate in this slide about the limits of patient autonomy. It is also important to note that intercultural bioethics argues that patient autonomy is sensitive to cultural orientation. Clinical application of patient's autonomy. Respect for patient autonomy is a standard practice of medicine. It entails that patients have the right to accept or refuse treatment, even life-sustaining ones. It encourages patients' ownership of their care plans. It asserts that patients should be involved in the decision-making with care providers as professional collaborators. The duty of patient autonomy. In this slide, we'd like to talk about the duty that care providers have, as well as patients have, because of autonomy. Just as patient's autonomy is not an absolute right, so the duties towards patient autonomy. Every care provider has an ethically and legally accepted duty to patients. In accordance with the standard of care, care providers have the duty to respect, act in patients' best interests, full disclosure, privacy, and confidentiality in order to promote patients' autonomy. There are responsibilities of patient autonomy on the side of the patient. A patient is expected to provide relevant and accurate information for proper diagnosis and formulation of treatment plans. A patient is expected to consider and cooperate with care providers' professional recommendations, take preventive measure in case of infectious diseases, ensure about the payment of the cost of treatment. A patient is also expected to properly use hospital equipment and to respect the care provider's autonomy. What are the scope or approach to patient's autonomy? There are essentially 2 approaches to patient's autonomy, which are based on societal worldviews. there is an individualistic approach to patient autonomy. This is a kind of approach that is well established in the Western world, where the individual is prioritized over the communal interest. But in some other climes, you could find the communalistic or the collective approach to patient autonomy. This is obtainable in societies where community-driven worldviews are prioritized over the individual. In the work of Bernata Solomon in 2005, a clear indication or argument was made in support of that kind of worldview, where the society or the community has certain powers over the individual. So whatever the community decides comes first before the individual preference. Are there limits to patient autonomy? Of course, there are some limits to patient autonomy. As stated earlier, patient autonomy is not an absolute ethical or legal right. There are about 2 limits to patient autonomy. And the first is, patients shall retain the right to autonomy only on the grounds that they are medically determined to have capacity or competence to assimilate, comprehend, process, and utilize voluntarily the information pertaining to their care. The second limit to patient autonomy is that patient autonomy can be overruled on the grounds of patient incompetence, proven medical futility, protection of third party, and state interest. What are the challenges or some of the challenges to patient's autonomy? The exercise of the right of patient autonomy could be plagued by a number of factors that fails to promote it. Some of these factors, although not exhausted in this list, are treating patients without informed consent, often mistaken as paternalism. The second challenge to patient autonomy is the lack of full disclosure of diagnosis and prognosis to patients. And we have misinformation as one of the challenges to patient autonomy. We have also every form of coercion that forces patients to act against their preference. And last but not the least is the mandate of choice and limited treatment options. All these could act as bottleneck to the expression or the thriving or the flourishing of patient autonomy. Summary points. In this presentation, we have looked at patient autonomy as one of the principles of ethics. Patient autonomy we define simply as the right of self-determination or self-governance. We've looked at the right of patients, the rights of patient autonomy imposes certain duties on both the patient and the care providers. We've looked also at patient autonomy could be defined from 2 different approaches, the individualistic and the communalistic approaches. We have also covered the limits to the right of patient autonomy, and the central point was that patient autonomy is not an absolute right. Patient autonomy could be plagued by a number of challenges, which we have mentioned in this presentation, and we have stated that when these challenges are addressed, it will help to promote the flourishing of patient autonomy. Also, there are some references that we could look at to deepen our understanding on patient autonomy, as well as to be able to grasp the length and bounds on patient autonomy. I hope that this presentation is helpful, and if you have questions, you can drop it on the comment below. Thank you.